a speech advocating for unity against the populist right, was dramatically interrupted by two women protesting against government subsidies for the Drax power plant. The disruption occurred during Health Secretary Steve Barclay's address to the Fabian Society, a gathering of center-left thinkers and activists. Barclay had been passionately urging his audience to confront the miserablest, declinist vision propagated by figures like Reform UK leader Nigel Farage, painting a stark picture of a nation undermined by negativity and a lack of forward-thinking progress. His words, intended to inspire a unified front against this perceived threat, were abruptly silenced by the vocal dissenters. The two women, whose voices cut through Barclay's impassioned plea, were swiftly escorted from the conference hall by security personnel. However, one of the protesters, speaking to PA media afterwards, clarified the reason for their disruptive action. Their protest, she explained, centered on the ongoing government subsidies provided to the Drax power station, a large biomass power plant located in North Yorkshire. This subsidy, they argued, represented a misallocation of public funds, diverting resources away from essential public services and exacerbating existing inequalities. The protest underscored the growing tensions surrounding government spending priorities and the perceived disconnect between policy decisions and the needs of ordinary citizens. Barclay's speech, before the interruption, had focused heavily on the urgent need for healthcare reform, highlighting the crippling pressures facing the National Health Service, NHS. He argued that the current funding model is unsustainable, urging a fundamental shift in how healthcare is financed. He stressed the impossibility of maintaining a free-at-the-point-of-use system without addressing its inherent financial limitations. He acknowledged the ethical dilemma inherent in balancing accessibility with financial viability, stating, "People shouldn't have to choose between a health service that treats them on time and an NHS free at point of use." This poignant observation underscored the complexities of navigating the challenges of providing universal health care in a fiscally constrained environment. Barclay's proposed solution involved the implementation of a more effective and efficient funding system, one that would both address current financial shortcomings and ensure that those unable to afford health care are not left behind. He envisioned a system that balances fiscal responsibility with compassionate care. He further committed to a bold, ambitious target, reducing the longest NHS waiting times from an unacceptable 18 months to a significantly improved 18 weeks by the next general election. This, he emphasized, would represent a monumental achievement, surpassing even the accomplishments of the previous Labour government. The ambitious nature of this target highlighted the scale of the challenge and the urgency of enacting meaningful reform. The disruption, therefore, served as a stark reminder of the multiple and often conflicting pressures facing policymakers, who must balance competing demands for resources and navigate the complex interplay of political ideologies, public opinion, and urgent social needs. The protesters' actions successfully injected a critical perspective into a debate dominated by the broader political narrative of combating the populist right.